Hey everybody, welcome back. We're in our, I believe, third lecture of chapter 9. So we're going to be looking at the pancreas and then we'll finish up looking at the testes and ovaries. And then we'll look at some other organs that have endocrine activities and aging in the endocrine system. So the pancreas is an organ that acts as both endocrine and an exocrine function. So it works in the endocrine system, but it also works in the digestive system. As an endocrine organ, we're looking at the pancreatic islets, or the islets of Langerhans, which produce different hormones. The two major hormones that we typically talk about are insulin and glucagon. These are opposing or antagonistic hormones. So insulin is produced by beta cells, glucagon is produced by alpha cells, and they work antagonistically of each other. And so here you can see the pancreatic islets found within the pancreas. So these are all exocrine, but we have some pancreatic islets found within there, okay? You can see one here, you can see there, you can see there. Alpha cells are found here, and then we have these beta cells here. Beta cells produce insulin, alpha cells produce glucagon, and we're going to look at what each does. Insulin is released when you have high blood glucose levels, and so it increases the amount of glucose uptake by our cells. So our body cells are stimulated to take in glucose, producing glycogen. Glucagon is released when we have low blood glucose levels. So this is stimulated to be released when our glucose levels are low, and it works on those exact same cells that took in the glucose from the insulin. But this time, the cells are going to be activated to break glycogen down and release the glucose back into the blood. So they work opposite or antagonistically to each other. And so here's a great example of that feedback mechanism. Again, negative feedback. And this is humoral. So control, humoral control. So here's balance. You want about, they say 90 to 100. I say about 80 to 100 milligrams of glucose per milliliter. Per 100 milliliters, not per milliliter. That'd be a lot per milliliter. But so this is normal. If something increases the amount of glucose in our blood, so say we had a really big ice cream shake or something, right? This is going to the increase in blood sugar levels stimulates the pancreas to produce insulin by those beta cells. Insulin then tells our body tissues to increase uptake of glucose and build up glycogen. This causes our glucose levels to fall back to normal. But if, say, we don't eat a meal, say we have not eaten anything, we just haven't had time, and our blood sugar drops, this is going to stimulate our pancreas, the alpha cells this time, to release glucagon. Glucagon then is going to act on our body cells to convert glycogen back to glucose, and glucose is going to be released. And the glucose release is going to increase blood sugar levels back to normal. So negative feedback. The last organs that we talk about in the endocrine system that are endocrine or that have a lot of endocrine function are your gonads, either ovaries or testes. And these organs produce sex hormones as well as they produce sex cells, so sperm and eggs. Females, our gonads, our ovaries are located in the pelvic cavity. Males are suspended outside the pelvic cavity because sperm production has to occur at a lower body temperature, lower than normal body temperature. The two hormones produced are estrogen and progesterone in female ovaries. In males, testosterone is produced. Estrogen stimulates development of secondary sexual characteristics in females, and it also helps to maturate the reproductive organs. Estrogen and progesterone together regulate menstrual cycles and breast development, as well as prepare the uterus for the placement of the embryo, or not embryo, of the blastocyst after fertilization occurs. Oh, well, there you go. Helps the implantation of an embryo, but really it's a blastocyst because the embryo forms by the end of 3 weeks and you've already implanted. And also helps prepare the breast for lactation. Males then produce testosterone by the testes, and this hormone is responsible for secondary sexual characteristics of males, maturation of male reproductive system, and production of sperm. So at this point, so it's been a while since I've given you one of these, but at this point, you should be able to tell me what hormones are produced by the pituitary gland, the thyroid gland, the parathyroid gland, the pineal gland, the thymus, the adrenal gland, the pancreas, the ovaries, and testes. It's a lot of questions on one little study guide page. So, other hormones produced by different organs. We have a lot of organs that produce hormones. Our stomach produces hormones. Our small intestines produce hormones. Both of these function in maintaining normal activity of our GI tract. Our kidneys produce hormones to help in maintaining blood levels of either blood pressure levels or blood cell levels. Our heart produces hormones. I talked about one, A&P, atrial natriuretic peptide, that helps in maintaining blood pressure levels. The placenta produces hormones that helps to maintain pregnancy. So the placenta actually takes over once the placenta has formed at about week 8. It starts secreting chemicals that help to maintain progesterone and estrogen levels, as well as it produces human placenta lactogen, which helps to prepare the breasts for breastfeeding, and it helps in secreting relaxins that help the pubic symphysis to open up a little bit further for childbirth. I talked about prostaglandins. I didn't really tell you a lot of functions, but prostaglandins, there are a lot of different types of prostaglandins, and so they all have different functions. They typically are released and act locally, so they either act on the cell that released it or on a neighboring cell. They can act as vasoconstrictors. They can cause respiratory passageways to constrict, so vasoconstriction of the respiratory passageways. They can cause inflammation, so a lot of different things depending on the type of prostaglandin. Gastrin is a hormone produced by the stomach that stimulates your gastric glands to release hydrochloric acid. Intestinal gastrin stimulates more motility of the stomach. Secretin is produced by the pancreas, or I'm sorry, is produced by the duodenum, and it stimulates the pancreas to release bicarbonate-rich juice. It tells the liver to increase bile production and the stomach to slow down. So basically, once food enters the duodenum, that's the first part of the small intestines, we want to be able to absorb as much nutrients, so our stomach activity slows down. This is usually about 30 minutes after we've started eating, which is kind of interesting because if you have ever tried to lose weight, one of the ways that they tell you to lose weight is to eat slower, because after about 30 minutes, once the food enters the first part of the small intestines, that's when you're going to you're going to slow down in desiring food because you're going to start feeling more full. Cholecystokinin is produced again by the duodenum, and it acts on the pancreas to release more enzymes to break down foods, tells the gallbladder to release bile, and duodenal papilla to relax, allowing bile and pancreatic juice to enter. And then erythropoietin, produced by the kidneys, tells our bone marrow to start producing more red blood cells. Here we have active vitamin D. Vitamin D, or calcitriol, is produced by our skin and liver and kidneys. So all together they do this, okay? So it starts at the epidermal. But the last organ is the kidney, and it stimulates the uptake of calcium into our cells or into our body, so we have higher calcium levels. A&P, which I talked about, produced by the heart, inhibits sodium absorption, inhibits adrenal cortex secretions, so we decrease the amount of fluid in our blood. Leptin is produced by adipose tissue, and it suppresses appetite. Resistin from adipose tissue is antagonistic to insulin action on the liver, so it's going to keep the it's going to not allow glucose to be taken in as effectively. The last thing we'll talk about then is the developmental aspect of the endocrine system. So in the absence of disease, our endocrine system typically stays healthy and activity is high until we hit old age. But once we hit old age, just like everything, as you age, things start breaking down. They don't work as effectively. So females, ovary function decreases as we get older. Once we hit menopause, we're going to stop producing our estrogens and progesterones. This is going to lead to problems such as osteoporosis and other issues. So that's one of the a major problem, because estrogens help in maintaining healthy bone. If we stop producing estrogens, then our bones are not going to be near as healthy. We're going to be more at risk for diabetes mellitus. The main type is type 2 that we'll be at risk for. Immune system, depression, so our immune system won't work as effectively. We'll have lower metabolic rate, which causes us to be slower, be tireder, and gain weight. So when you see those old people that are a little bit heavier than they used to be nice. Could be their endocrine system acting up. And of course, we're going to have a higher rate of cancers in certain organs. At this point, you should be able to tell me other organs that produce hormones. What are those hormones? And how does age influence the endocrine system? That's the end of our chapter, so I'm going to stop here. There is one more video you'll have to watch. It's about blood sugar levels, but I will post that in just a short bit. Bye.